Honorable Deputy Prime Minister, distinguished guests, ladies and gentlemen, good morning. It is my great pleasure and honor to welcome you all at the opening of the Primary Healthcare 10th Biennial Conference, and we are proud to be able to host it today here at this pleasant setup. At the very outset, I would like to express my sincere appreciation to all of those who generously supported our team to ensure a successful event. I shall not be mentioning names, as I am afraid I may leave someone out. Indeed, we couldn't have done it without you, and thank you. When I addressed the 2017 Primary Healthcare Conference precisely 2 years ago, I stated that I had only been appointed as CEO of Primary Care 18 days before. Nevertheless, I was really afraid and terrified, believe me. Nevertheless, I promised to take up the challenge and with most positive attitude for yet another exhilarating journey within the health province. And surely enough, I did. With the extreme satisfaction and indeed immense pride, backed with the tremendous enthusiasm of a prolific team, we have effectively contributed massively for the unprecedented levels of development in the primary healthcare in the last 24 months. In a few moments, the statement will be given credence that it merits, with the list of accomplishments it is spelled out. In achieving this objective, we established at the very outset a common front, a positive psychological bonding that enabled my team, and surely most of you that I'm seeing here with us today, to go the distance with a firm, agile mindset enough to change direction whenever the need arose, as we assertively focused on the mantra and theme of today's biennial conference, Together Towards Excellence. We succeeded in achieving in so much in such a short span of time because we didn't fall into the trap of confusing what was being measured with the metric itself. Our strategy was and is always purpose-driven, as outlined in our mission statement. By putting purpose at the center of our strategy, we achieved an integrated organization, motivated and empowered workforce, focused collective objectives that created opportunities for growth, and defined how we will contribute to the primary healthcare in general and to the society at large in particular. At the primary healthcare, I find that thinking outside the box is commonplace at all levels, and there is a strong affinity and trust between the management and the staff. The state of play enhanced my communicating the organization's strategic objective, and they generated the desired level of employee emotional commitment, engagement, accountability, responsibility, and yes, retention. The primary healthcare team, having been chosen finalist for the Workers of the Year Award of 2018, upholds my beliefs and strengthens my trust in my workforce. This progress achieved in the last 2 years is a firm testimonial for such a conviction. We have successfully introduced innovative primary healthcare models to enhance the equity, efficiency, effectiveness, responsiveness, and resilience of our health systems, to improve health outcomes, most importantly, to positively develop user satisfaction. Suffice it to mention that such a short spell we have carried out major refurbishments at a number of community clinics across the Maltese Islands, thereby facilitating the new primary healthcare outreach of core services concept. These include the ones at Shawkia Gozo, Zabuch, Malta, Zurri, Zabar, Pieta, Attard, and Kirkop Health Center, and very soon we'll be going to open Zaytoun. Launched a number of services in the community, with the most recent being the phlebotomy service, focused on establishing centers of excellence. The first two include the Primary Eye Screening Center and the Speech and Language Pathology. We're currently working on the third one. More will follow. Introduced the mental health well-being, perinatal and transgender clinics, engaged a list of medical consultants to address diabetes and endocrinology, ophthalmology, cardiology, and soon palliative care at primary care level. Intensified our drive on the execution of the National Cancer Screening Awareness Program with special emphasis to breast, cervical, and colorectal screening. Secured the Equality Mark certification awarded by the National Commission for the Promotion of Equality. Worked incessantly towards licensing all the health centers, clinics, and towards predisposing the primary healthcare to attain international accreditation and standardization. In conformity with the Minister's declared policy, entered into a memorandum of understanding with the Association of Local Councils, with a view to giving better and timelier patient access, together with an improved quality of care closer to the patient's home. In the framework of the current agreement between BARDS, the London School of Medicine and Dentistry, and the Maltese Ministry for Health, over 98 students from the Gozo campus were assigned to and worked with doctors and clinicians in the primary healthcare environment. The commendation by BARDS management is indeed warmly cherished and appreciated by the primary healthcare team. Concurrently with the compilation of our long-term strategy, the creation of brand awareness of the primary healthcare and the redefining of our mission statement assumed mandatory priority. We wanted the primary healthcare to be the brand that stands out by adding a sense of color to our positioning, as we guaranteed a firm platform for highly successful operation. This philosophy is in total harmony with our renewed mission statement that denotes our multidisciplinary team is committed to excellence to the highest possible level and quality of integrated primary healthcare service delivery, while we continue to explore new avenues to increase patients' accessibility further into the community. The 6 news bulletins that covered the 2-year period since my appointment as CEO served to present a clear narrative for communicating the rationale for transforming the primary healthcare, a storyline that conveyed the principles of our mission. To supplement this branding drive, we participated in numerous TV, primetime, and radio programs, including the entire 2019 Autocura series, with no less than 40 programs dedicated to the services provided by the primary healthcare. As you know, we are living in the era of accelerated innovation and an era of discoveries, new technologies, artificial intelligence, and more. Our drive to ensure that all primary healthcare professionals can access and interact with the patient records and care plans where they are is our continued work in progress. In reality, we have exploited the benefits of the new digital technologies to ensure there are sufficient controls in place. For the first time ever, we at Primary Care introduced a holistic supply chain logistics management system that is transparent, accountable, and traceable, with the main objective to introduce cost-efficient mechanisms. This was complemented by the introduction of radio frequency identification technology, commonly known as RFID, to ensure real-time inventory control and the introduction of temperature-controlled transportation for the collection and delivery of blood and other samples to the MDH pathology lab. On the international front, it was a great honor to have been accredited by the government of Malta to represent the country at the WHO Global Conference on Primary Care held in Astana, Kazakhstan, on the occasion of the 40th anniversary of the History Declaration of Almaty. The declaration had been adopted during the 1978 First International Conference on the Primary Healthcare. The Astana Declaration of 2018 devised a pathway on how it can transform the future, with the renewal of the commitment towards primary care to achieve universal health coverage and UN's Sustainable Development Goals. My team and myself are in the process of giving the primary healthcare more visibility with the WHO. Against this background of this progress, we are paying particular attention to the importance of development and developing a multidisciplinary trained and educated workforce with a wide range of skills and expertise, both across health systems and in the sectors of community for the delivery of effective population-based services, a workforce that has kept up with the increased demands. The recent intake of doctors, pharmacists, nurses, and paramedicals is surely a blessing, but it is not enough. Ladies and gentlemen, undisputedly, the very exceptional achievement we have managed to secure in the last 24 months, and which I have opted to project distinctly and with predominance, was however recorded in May. In May of this year, we reached a zenith of our resolve, in my view, a historic chapter and a key determining factor in the development of the national health services at primary care level. The National Development and Social Fund and the Primary Healthcare signed the momentous agreement whereby the primary healthcare secured a €10 million grant that will lead to the thorough modernization of 8 health centers and 54 community clinics by end 2021. This is an ambitious mega refurbishment program and includes Gżira, Bukirkara, Floriana, Ormi, Kospikwa, Rabat, Mosta, and the new Gozo Health Center. The Paola and Kirkop Health Centres are not part of this grant, as the Paola Health Centre will be eventually replaced by the Vincent Moran Regional Hub, which is an EU-funded project, and the Kirkop Health Centre is 1 year old and needs routine upkeep and not mega refurbishment. The aforementioned rollout of new service, renovation of premises, capital expansion, accreditation at national and international levels, and corporate branding are, however, just precursors of a phenomenal development period in the months that lie ahead. In the coming months, we shall continue to invest in our infrastructure and information communication technology, provide additional training opportunities, and boost our approach towards exceeding our clients' needs. It is being envisaged that in the coming weeks, the Gżira Health Centre will enter into the extensive refurbishment phase, and so will the podiatry area of Birkirkara Health Centre, which once ready, it will be our third centre of excellence. Concurrently, we shall be working on the publication of tenders for the Northern Regional Hub, on the refurbishment of a number of community clinics, together with the Foundation of Medical Services. We shall also be working on the progress of the Vincent Moran Regional Hub and the Victoria Health Centre in Gozo. By the end of this year, we shall be embarking on the introduction of the Central Financial Management IT system, which will facilitate real-time monitoring of our budgetary financial records, the electronic patient record system, the iStock IT system for the monitoring and control of stocks across the primary healthcare perimeter from one central point, the further expansion of the RFID system, and we shall also be exploring ways and means of how to leverage the position of the private GPs so as to ensure that primary healthcare is benefiting from all its available resources. We shall be working on the establishment of a Diabetes and Endocrinology Centre of Excellence, which will function in unison with the Primary Eye Screening Centre, the podiatry, the dietitian, the nutrition, so that we will tackle diabetes as one in its holistic entirety. The introduction of GU clinics at common level and much more are also being contemplated. Ladies and gentlemen, it is my firm belief, and I am sure it is yours too, that health is a fundamental right for all humanity, and surely not a privilege for those who can afford it. It is the foundation for families to blossom, society to prosper, and nations to develop. It is the key of an effective health system and the cardinal ingredient to achieving universal health coverage. Indeed, politics is a determining factor for the advancement of health, and the virtual bipartisan understanding that our nation enjoys will surely never hold back the continued development of healthcare to the advantage of all our community. Working together is in closer cooperation rather than disjointly, and shows that our commitment of achieving better health for all is effectively accomplished. On other occasions, I have expressed my feelings that the biggest challenges are to timely deliver on the government's demanding commitments and with the available resources. Nevertheless, with your loyalty, support, and determination, we will, in concert and as hitherto, adjust our sails to timely reach our destination. With this exciting political will and virtual wide consensus to wide patients with more options, better support, and timely care services in a comfortable and pleasant environment, we will truly achieve our goal in becoming the patient's automatic point of choice. In closing, I have to express my gratitude to all of those who have contributed to this success, including the workforce at the primary healthcare, my colleagues in various sectors of the health department, the leadership of the Foundation of Medical Services, and the team at the Ministry for Health under the leadership of the Deputy Prime Minister and the Minister for Health. Thank you for listening.